The term shoulder impingement is being phased out and replaced with either rotator cuff tendinopathy or just shoulder pain syndrome. This video looks at why, the research and the clinical relevance. Let's start with the research. Shoulder impingement syndrome was first introduced in the 1970s by the orthopedic surgeon called Dr. Charles Neer, who proposed that most shoulder pain was caused by impingement of soft tissue structures within the subacromial space, and that surgically increasing this space by removing part of the acromion would reduce shoulder pain. However, research informs us that the supraspinatus partial thickness tears mostly occur between the tendon and the humerus, and not between the tendon and the acromion. Research also fails to identify a key link between the shape of the acromion and shoulder symptoms. This means that patients with a type 3 acromion are not necessarily at risk of developing shoulder pain. The third piece of research, and perhaps the most important clinically, is that subacromial decompression surgery has no additional value over a placebo surgery and a non-surgical group. So rather than impingement causing the pain may be caused by rotator cuff tendinopathy from unaccustomed loading, from unaccustomed activity, and from a compression element to the tendon as it goes over the humerus. This is similar to tendinopathies commonly seen in the lower limb, including the Achilles and gluteal tendinopathies. So the difference in terminology from impingement to tendinopathy is not just semantics and actually makes a big clinical difference. Here's why. The classic impingement diagnosis creates the idea that there's a structural pathology, and this is worsened by abduction movements, because the idea is that the shoulder lifts and causes an impingement. As soon as the patient thinks this, there's a structural problem made worse by this movement, the likelihood of them engaging in movement rehabilitation is greatly reduced, and this creates a significant nocebo effect. If a patient then receives some results of imaging, which comments on the shape of their acromion, then this may further reduce their willingness to exercise and lead them down a path towards surgical intervention. And as we've just discussed, surgery does not lead to better outcomes and may be an unnecessary procedure for most patients. I hope you found this video helpful. Please have a look at the shoulder treatment playlist if you're looking for some shoulder rehabilitation ideas for your patients.